Hello there. Well, I have to say that for the last 24 hours, the nation perhaps not thinking quite that much about coronavirus because we're remembering a couple of legends. Rishi Kapoor passed away today, Irrfan Khan, who passed away yesterday. We have been remembering all the great moments that they left us with, and for a while we've stopped thinking a bit about coronavirus.
The funeral of veteran actor Rishi Kapoor, who passed away today at the age of 67, was held in Mumbai's Chandawadi crematorium. The last rites were performed in the presence of some close friends and family members due to the nationwide lockdown. The actor died after a prolonged illness with leukemia at a hospital in Mumbai.
Legendary actor Rishi Kapoor has passed away after a prolonged battle with cancer. Born in 1952 in the first family of Hindi cinema, Rishi Kapoor was Raj Kapoor's son and legendary actor Prithvi Raj Kapoor's grandson. Rishi Kapoor made his first appearance in movies at the tender age of 3 in Shri 420. He won a national award for his debut role as a child artist in his father Raj Kapoor's 1970 film Mera, Naam, Joker. He became an overnight sensation with his first film as a leading man in the 1973 film Bobby opposite Dimple Kapadia. Rishi appeared opposite Neetu Singh in 12 films. The teenage romance, which bloomed around 1975, ended in the couple getting married in January 1980. For close to 50 years, Rishi Kapoor has regaled audiences with his stellar performances from Mera Naam Joker to the naughty 90-year-old man in Kapoor and Sons. Some of Rishi's memorable films include Rafu Chakkar, Karz, Khel Khel Mein, Sargam, Amar Akbar Anthony, Naseeb, Sagar, Prem Rog, Chandani, Bol Radha Bol and Damini. Rishi Kapoor was last seen in The Body alongside Imran Hashmi and had recently announced his next project, a remake of the Hollywood film The Intern. In a career spanning over 5 decades, Kapoor did over 90 films and won several awards amongst a national award.
A scene from Rishi Kapoor and Irrfan Khan's 2013 film D-Day is going viral on the internet, as not just the film fraternity, even fans are unable to come to terms with the demise of these two legendary actors. From comments like 2 days to legends to fans thanking the stars for their contribution to cinema, internet is full of tributes.
So I'm going to keep it short today, just to tell you that testing has continued to increase in India. India is now at the 8th rank when it comes to coronavirus testing, with more than 800,000 cases or so. India is also at about the 16th rank when it comes to coronavirus cases and at the 18th rank when it comes to COVID deaths. So testing has picked up, and the rank of India when it comes to coronavirus deaths and cases is roughly the same as it has been for the last 2 to 3 weeks. I just want to spend a couple of minutes looking at the rest of the world, though, what's happening. Worst affected country by far is obviously the United States, 4% of the world's population, but more than 1 million cases. That's roughly a third of the world's coronavirus cases is in the United States. And with 61,000 deaths by now in the United States, that's more than in the entire war in Vietnam. In a few days, for all you know, it could be Vietnam plus Iraq and maybe Afghanistan as well. So US obviously the most affected. Among other countries, if you take a look at it, and specifically at the factor of deaths per million, then Belgium seems to have been really badly hit, because Belgium is seeing 647 deaths per million. Spain 519, Italy 458. Then there's that really interesting case study of Sweden, one of the countries that has, in a sense, not really had a lockdown. It's allowed people to do pretty much what they want. And it's seen, more than 2,000 deaths, but deaths per million is about 244. Not quite as good as Germany, let's say, but better than countries like Belgium or Italy or France or many other countries in Europe. Now, India, by the way, when it comes to deaths per million, is at 0.8. So well below that, but all per capita numbers in India are always low. One, of course, big question that we are still waiting to get more answers from is Africa. What exactly is happening in Africa is a bit of a mystery, and I'm going to address that in the next couple of days. But let's now show you all the big news stories from across the country.
The Union Health Ministry on Thursday said that India's coronavirus recovery rate, which means the share of people who have been discharged from the hospital after recovering from Covid-19, has improved to 25.19%. About 2 weeks ago, the recovery rate stood at 13%. A total of 8,324 patients have recovered, the Health Ministry official said.
रिकवरी रेट के अंदर हम एक प्रोग्रेसिव ट्रेंड ऑब्जर्व कर रहे हैं। जैसा कि आप लोगों को इससे पहले भी बताया है कि 14 दिन पहले का अगर रिकवरी रेट देखें तो वह 30.06% था, जो कि अब बढ़कर 25% के ऊपर पहुंच गया है। यह एक बहुत ही पॉजिटिव साइन है।
While the average number of coronavirus cases in the country are doubling in every 11.3 days, 9 states and union territories are witnessing the doubling in 20 days and above. Doubling time means the number of days it takes for the COVID-19 cases to duplicate. According to the data released by the Health Ministry, among the 9 states, coronavirus cases in Assam are doubling in 59 days, Telangana in 70.8 days, Chhattisgarh in 89.7 days, and Himachal in 191.6 days. Union Health Minister Harshvardhan had earlier said the rate of growth of new cases in the country is steadying. Before the lockdown, India's doubling rate was about 3 days.
The green and orange zones in Uttar Pradesh are likely to see a gradual easing of the lockdown from May 4th, but no respite is expected for the 15 districts in the red zone. UP Chief Minister Yogi Adityanath has asked officials to prepare a plan for allowing economic activity in green and orange zones after May 3rd, a report said. However, he has reiterated that no social gathering will be permitted in the state till June 30th. According to official spokesman, the 15 districts that are presently in the red zone, however, will not witness any relaxation in lockdown rules. According to Crisil research, the ongoing economic disruption due to COVID-19 is likely to result in a permanent loss of 4% of GDP for India. The report added that the GDP growth may go towards zero in 2020-2021 if the lockdown is extended. The economy is unlikely to recover for the next 3 years, noted D.K. Joshi, chief economist at Crisil. Terming the current 1.7 lakh crore rupee fiscal stimulus as inadequate, Joshi said that fiscal measures could end up requiring about 3.5 lakh crore rupees in funds. The US government, through its aid agency USAID, has announced an additional grant of $3 million to help India combat the coronavirus pandemic. Earlier in the day, US Secretary of State Mike Pompeo had said that the US is working with friends in countries like India on the COVID-19 crisis. He had highlighted India's lifting of the ban on key drugs as an example of cooperation.
In some promising news, the results of a major clinical trial in US showed that the antiviral drug Remdesivir had patients recover about 30% faster than those on placebo. This is the first time any medication has shown to improve outcomes against the COVID-19 illness. The results also suggested that people who were on the drug were less likely to die, although the difference was small. President Donald Trump described this as a positive event and said he was in support of doctors prescribing it more widely.
That the data shows that Remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery.
The World Health Organization on Wednesday confirmed it was investigating a rare inflammatory condition found in children possibly linked to the new coronavirus. The condition, thought to be similar to Kawasaki's disease or toxic shock syndrome, has been identified in the UK, and doctors in Britain, Italy and Spain have been warned to look out for it by Britain's Pediatric Intensive Care Society.